Assalamu alaikum. Our talk today about viral hepatitis. I'm wishing everyone a good health and safety. Talking about hepatitis, which is an inflammation of the liver, which may result from various causes like viral, bacterial, fungal, and parasitic infestation. We call it infectious causes, or we have non-infectious cause of hepatitis, for example alcohol, drugs, autoimmune, and even metabolic diseases. Viral hepatitis is infection affecting the liver predominantly caused by 5 kinds of viruses, that is hepatitis A, B, C, D, and E. The 5 kinds of viruses may produce similar clinical illness. The history of viral hepatitis goes back thousands of years when humans were first infected by such agent. A natural repetitive cycle began with the capacity to infect billions of humans. There are reports on outbreaks of jaundice epidemics in China 5,000 years ago and in Babylon in more than 2,500 years ago. The catastrophic history of great jaundice epidemics and pandemics is well known and generally associated with major wars. In the Second World War in 1939 to 1945, a series of outbreaks occurred after vaccination for measles and yellow fever, which indicate that the virus was bloodborne. I think the talk here is about type B hepatitis. The number of cases of hepatitis during the Second World War was estimated to be 16 million. Regarding history of viral hepatitis, in 1947 they classified viral hepatitis into 2 types: infectious hepatitis, type A, and serum hepatitis, type B. In 1968, isolated the Australian antigen in hepatitis B patient. The first vaccine for hepatitis B produced in 1981 and licensed as Heptavix. In 1970, hepatitis A virus was isolated. In 1989, hepatitis C virus was isolated. And in 1990, hepatitis E virus. And in 1995, hepatitis G virus were identified. Viral hepatitis is a common cause of jaundice and must be considered in anyone who is presenting with hepatic liver blood test. The meaning of hepatic liver blood test means high liver enzymes, high transaminases. The causes of viral hepatitis, so type A hepatitis, the most common type A hepatitis, common in children. Type B hepatitis, which is a bloodborne infectious hepatitis, اللي سابقا كنا نسميه serum hepatitis. And on the top of B you may get hepatitis D, يعني D يجي فوق ال B. Number 3 hepatitis C, or number 4 hepatitis C, then hepatitis E and hepatitis G. We have CMV, EBV, and herpes simplex and yellow fever viruses, and etc. All these viruses cause illness with similar clinical and pathological features, so they have similar clinical presentation, are frequently anecteric, يعني يمكن يصير without jaundice, or even asymptomatic. They differ in their tendency to cause acute and chronic infections and its differentiation based on the duration of the illness. Acute hepatitis can last up and rarely exceed 6 months in duration. So any inflammation of the liver, hepatitis for more than 6 months, this is a chronic hepatitis, not acute hepatitis. Viral hepatitis type A to E may induce acute hepatitis. Then any viral hepatitis may cause acute hepatitis. لكن بالعكس chronic hepatitis or chronic carrier state is defined as having the disease for more than 6 months, and only for hepatitis B, C, and D, اللي يسمونه chronic hepatitis. The clinical presentation of hepatitis G is still under investigation. are the complications of acute viral hepatitis? If any patient get viral hepatitis, he may develop acute liver failure, very low percentage, 0.01%. He may have fulminant hepatic failure, in which the mortality is very high. Or in type A hepatitis, he may have cholestatic hepatitis. We call it cholestatic hepatitis, in which the patient have deep jaundice. He may have itching with high alkaline phosphatase. Aplastic anemia, chronic liver disease and liver cirrhosis, as I mentioned, type B and type C mainly, and relapsing hepatitis, recurrence hepatitis. Especially, we have two types of relapsing, either biochemical relapse or clinical relapse. So this is the hepatitis virus, which can cause chronic liver disease. Only HBV, hepatitis B virus, hepatitis C virus, and delta virus. A delta on the top of B. Now, we are going to talk about hepatitis A, the commonest type of hepatitis, hepatitis A, which is highly infectious and is spread by fecal-oral route. The virus excretes in the feces for about 2 to 3 weeks before the onset of symptoms, and then for further 2 weeks or so. Infection is common in children. Infection is common in children, but often asymptomatic أو anicteric مثل ما قلنا may occur in areas of overcrowding and poor sanitation. So the viral hepatitis type A is commonly in areas when there is poor sanitation or overcrowding. In occasional outbreak, water have been the vehicle to transmission. Then hepatitis A virus is common affection of children, is typically in acute. It is a self-limiting illness associated with non-specific symptoms, in contrast to hepatitis B, which is a chronic and carrier state does not occur. So there is no chronic state and there is no carrier state in hepatitis A. So in children, the commonest type of hepatitis is type A hepatitis. And this is the diagram of hepatitis A virus. This is an RNA virus with a capsid. A non-specific prodromal illness. How could patients with hepatitis type A present? You could present with prodromal illness, which could be a non-specific, characterized by headache, myalgia, arthralgia, nausea, and anorexia. Usually precede the development of jaundice by a few days to 2 weeks. إذا presentation عادة non-specific symptoms: arthralgia, myalgia, headache, low-grade fever, and GIT upset. Vomiting and diarrhea may occur, and abdominal discomfort. بعدين هنا راح يبين عندنا jaundice, which may be mild or moderate, with dark urine and pale stool. There are usually few physical signs. The liver is often tender but minimally enlarged. So there is tender liver, which may be enlarged slightly. Occasionally mild splenomegaly and cervical lymphadenopathy are seen. What are the symptoms of hepatitis? So the commonest symptoms, as I mentioned, is fever with GIT upset in form of loss of appetite, nausea, vomiting, abdominal pain, and we have jaundice, fatigue, dark urine, pale stool, and joint pain. How do you investigate patients with hepatitis type A? مثل ما قلنا يصير عندهم hepatic pattern of liver function test, يعني elevation بالserum enzymes اللي يوصل 200 to 2000 urine per liter. The plasma bilirubin reflect the degree of liver damage. The more the jaundice you have, the more liver damage. The alkaline phosphatase rarely exceed. شو وقت يصعد عندنا الالكالين phosphatase بالهيباتيتس type A؟ من يصعد عندنا cholestatic hepatitis, one of the complication of hepatitis type A. Prolongation of prothrombin time, PTINR, will be prolongate, which indicates severe liver damage. Then prolonged PT indicates severity of the hepatitis, except in rare cases of acute liver failure, rarely exceed 25 seconds. The white cell count is usually normal with a relative lymphocytosis. Serological test and viral markers مهم جدا هنا. These viral markers to confirm the etiology of the disease. الفيرال ماركرز هي الهاف antigen and antibody have antigen and antibody. الانتي have يعني الانتيبودي هو of IgG and IgM. IgM type is important in diagnosis. IgM type as have is only present in the blood transiently during the incubation period. الهاف antibody of IgG type is of no diagnostic value. من صار عندنا positive احتمال هذا يكون عندنا old infection. So it has no diagnostic value as have infection is common and this antibody persists for years after infection, but it can be used as a marker of previous have infection. How do you manage patient with hepatitis type A? Most individuals do not need specific treatment and there are usually no need to hospitalize them. During such as a sedative and narcotics which are metabolized in the liver should be avoided. So avoid sedative, avoid narcotics, no specific dietary modification, and during the illness, and safe water supply, food safety, improve sanitation, hand washing أهم شيء هاي. And the hepatitis A vaccine are the most effective way to combat the disease. Persons at high risk, such as travelers to countries with high level of infection, can get vaccinated. Infection in the community is best prevented by improving social conditions, especially overcrowding and poor sanitation, and you can give immunization. Immediate protection, إذا صار عندنا immediate contact with a jaundice patient type A, you can give immune serum globulin soon after exposure to the virus. يعني within 24 to 48 hours you can give immune serum globulin. Acute liver failure اللي قلنا هاي rare complication of type A اللي هو 0.1%, and chronic infection or carrier state does not occur. Have infection in patient with a chronic liver disease may cause serious or life-threatening disease. Cholestatic phase of hepatitis يعني هو عنده type A hepatitis صار عنده slightly improvement regarding the appetite, regarding nausea, vomiting, abdominal pain, symptoms, لكن jaundice is increasing, alkaline phosphatase increasing, slightly reduction in the enzymes. هنا دخل بالcholestatic phase of hepatitis. This is one of the complication of hepatitis type A. شلون نعرف؟ TSP يصعد ويصعد وياها الالكلاين phosphatase والpatient may have itching. Now we are going to talk about hepatitis type B. Type B hepatitis اللي هو the most important type B hepatitis. ليش important? It may cause chronic liver disease, liver cirrhosis, and hepatocellular carcinoma, and even chronic carrier state. So the most common cause of chronic liver disease and hepatocellular carcinoma worldwide هو type B hepatitis, and may cause an acute viral hepatitis. ممكن يجينا acute viral hepatitis is less than 6 months and with complete recovery. However, the acute infection is often asymptomatic. يعني حتى من يصيرون دول acute hepatitis usually asymptomatic, particularly when acquired at birth. Vertical transmission. Many individuals with chronic hepatitis B are also asymptomatic. Approximately 1/3 of the world's population have serological evidence of past or recurrent infection with hepatitis type B, and approximately 350 to 400 million people are chronic HBs antigen carrier. يعني 350 ل 400 مليون بالعالم هم chronic HBs carrier. 2 billion مليارين with evidence of past or present history of hepatitis. This is the diagram showing the hepatitis type B virus. What are the source of type B hepatitis? We have two main sources, either horizontal or vertical. The horizontal transmission 10% coming from infected unscreened blood products. لذلك هسه no blood giving to any patient during blood transfusion without testing. It should be tested for HBs antigen. Tattoo and acupuncture needle Injection drug use, sexual, both homosexual and heterosexual, with close living catheters. These are the main source of horizontal transmission, which is about 10% of the hepatitis B, while the majority, 90% of cases of hepatitis type B, coming from vertical transmission, from HBs antigen positive mothers to the baby. The risk of progression to chronic liver disease depends on the source and timing of infection. In vertical transmission, from mother to child in perinatal period, is the most common cause of infection worldwide and carries the highest risk of ongoing chronic infection. Yani when you get infection vertically, the incidence to get chronic liver disease are more than when you get infection horizontally. In this setting, adaptive immune responses to HBs virus may be absent initially with apparent immunological tolerance. Chronic hepatitis can lead to cirrhosis or hepatocellular carcinoma, usually after decades of infection. Chronic hepatitis B infection is a dynamic process that can be divided into 5 phases. 5 phases اللي يمر بها chronic hepatitis type B. بس يبقى full recovery in 90 to 95% of adult is the usual. Full recovery following acute hepatitis B viral infection. This is the map showing the incidence of hepatitis around the world. It's divided into 3 types, either high percentage, more than 8%, or intermediate, 2 to 7%, or low when it is below 2%. In our country here, the incidence is intermediate, between 2 to 7%. I think in our country 5%. Serology of hepatitis very important. نعرف السيرولوجي مال hepatitis B viral infection. أهم شيء هو ال HBs antigen, which is usually indicate of active infection. إذن أول شيء ندز المريض هو HBs antigen. Evidence of recent infection shown by presence of hepatitis B core. أكو recent infection نعم. HBC antibody positive. IgM type. C core مو ال C. The persistence of HBs antigen for longer than 6 months indicate chronic infection. Antibody to HBs antigen, antibody now, to HBs antigen usually appear after 3 to 6 months and persist for many years or perhaps permanently. الهيباتيتس B antibody implies يعني يصير عندنا hepatitis B antibody positive in either patient in the previous infection أو previous vaccination. شلون نعرف ال previous infection من ال previous vaccination? In which case هنا بال previous infection ال HBC antibody positive, previous vaccination HBC antibody negative. Hepatitis B core antigen ال HBC is not found. إذا ما عندنا احنا HBC antigen, عندنا بس HBC antibody IgG and IgM type. The HBC antibody of IgM type with IgG antibody appear later. The anti-HBC IgM can sometimes reveal an acute hepatitis B viral infection when the HBs antigen has disappeared and therefore anti-HBs has developed. هنا يختفي عندنا الانتيجين بس ممكن ال HBC IgM type will indicate infection. The hepatitis B E antigen, هذا مهم جدا. E antigen يعني HBE antigen is an indicator of active viral replication. فإذا عندنا ال HBE antigen positive معناته very active viral replication and highly infectious patient, followed by production of antibody. بعدين يطلع عندنا ال HBE antibody. فأهم شيء عندنا حقيقة هو ال HBE antigen. إذا positive معناته ال patients highly infectious ومعناته there is active viral replication. طبعا ويا ال HBE عندنا ال viral load مهم جدا. Chronic hepatitis B infection is marked by presence of HBs. شلون نعرف هذا chronic؟ HBs antigen positive, HBC IgG positive in the blood. Usually HBE antigen هاي إذا كان highly infectious أو HBE antibody is positive. HBE and HBE antigen indicates continued active viral replication مثل ما قلنا of the virus in the liver, و the presence of anti-HBE. هاي مهم جدا. إذا لقينا الانتي HBE يعني HBE antibody معناته عندنا low viral replication. إذا ويا ال HBE antigen بالنسبة للviral replication عندنا high viral load. In contrast, in those with low viral replication, HBs antigen and anti-HBE antigen positive, viral load are less than 10 to the power of 5 copies per ml. اكو شيء يسموه pre-core mutant infection in which high level of HBV DNA يعني الفيروس عالي DNA viral despite negative HB antigen. Negative HB اللي هو unlikely وهي high viral load. It cannot secrete E antigen. هنا الفيروس cannot secrete E antigen in the serum. Such patient will be high antibody of HBE positive but have a high viral load and often evidence of chronic hepatitis. This is the diagram of the virus. This is a DNA virus. هذا هنا هو السيرفس والكور وهذا الإي antigen. This is another diagram of hepatitis B virus. A DNA virus composed from surface antigen, the E antigen, and the core. This is the core. How do you manage patients with hepatitis type B? Acute hepatitis. إذا جانا acute hepatitis type B, treatment is supportive, just like يعني acute type A. There's no specific treatment with monitoring for acute liver failure. خاف يطلب acute liver failure, which is 1% of cases. Chronic hepatitis هي هنا المشكلة. Chronic hepatitis type B treatment are still limited as no drug is able to eradicate hepatitis B infection completely. The goal of treatment are HBE antigen seroconversion. يعني ليش نعطي treatment لل HBs positive patient نعطيهم حتى نحول ال HBE antigen positive to HBE antigen negative. HBE antigen seroconversion نسميها. HBE antigen seroconversion, reduction in HBV DNA and normalization of LFTs. إذا لازم يقل عندنا الفيرال لود و HBE seroconversion و normalization of the liver function test. This is the goal of treatment. The indication for treatment is high. يعني مو كل مريض HBs positive نعطيه treatment. جزء هو carrier state. بالcarrier state no treatment, only follow up. Indication of treatment, high viral load. Number one, high viral load in the presence of active hepatitis. شلون نعرف active hepatitis? By elevated enzymes. إذن high viral load, high liver enzymes، أو نسوي له احنا biopsy histological evidence of inflammation and fibrosis. إذن high liver enzymes, high viral load, active، وبعدين عندنا ال HB antigen positive معناته هذا high viral load with active replication. Treatment, previously we give interferon alpha. 33% lose antigen after 4-6 months of treatment. Lamivudine, antiviral agent. Adifovir, another antiviral agent. Pegylated interferon, now we can use it for 6 months, which eliminate HB antigen in 35%, and treatment for 12 months lead to normal liver biochemistry in 60%. Entecavir, هذا هسه الجديد. Entecavir والtenofovir are a potent antiviral. هاي يحفظوها. Entecavir and tenofovir are a potent antiviral with a high barriers to get to genetic resistance, and so are the most appropriate first line agent. Entecavir and tenofovir, which suppress the hepatitis B viral DNA level in 67% compared to 36% with lamivudine and 60% with Tenofovir, you can use it alone, has recently been shown to be superior to adenofovir اللي هو tenofovir, very important in the treatment of hepatitis type B. Regarding prevention of hepatitis B, individuals are most infectious when markers of continuing viral replication such as HBE antigen and high level of HBV DNA are present in the blood. The virus is about 10 times more infectious than hepatitis C. 10 times more infectious than hepatitis C, which in turn is about 10 times more infectious than HIV. إذا highly infectious هو ال HBs antigen، بعدها ال C، بعدها ال HIV. A recombinant hepatitis B vaccine، عندنا موجود vaccine recombinant hepatitis B vaccine containing HBs antigen is available اللي هو ال Injurex and is capable of producing active immunization in 95% of normal individuals. The vaccine should be offered to those at high risk group، نعطيهم للهاي ريسك جروب. طبعا high risk group مثل ذول ال close contacts of infected individuals, newborn of infected mothers, regular sexual partners, a patient on chronic hemodialysis, patients with chronic liver disease. احنا طبعا doctors, nursing staff, even medical students, laboratory personnel، كلهم دول يعتبرون high risk group with parenteral drug users. طبعا men who have sex with men أيضا have a high risk group. So in all those patients and all those individuals we can give them a vaccination. طبعا infection can also be prevented by or minimized by intramuscular injection of hyperimmune serum globulin. يعني إذا صار عندنا direct contact with a patient with HBs positive patients في خلال 24 to 48 hours you can give them hyperimmune serum globulin in active immunization. Infection can be prevented or minimized by the intramuscular injection of hyperimmune serum globulin prepared from blood containing anti-HBs. This should be given within 24 hours or at most week of exposure to infected blood in circumstances likely to cause infection. يعني واحد مثلا check من أوبرا من patients والpatient طلع بعدين HBs positive. Vaccine can be given together with hyperimmune serum globulin. فإذا كان هو ما ماخذ vaccine فنعطيه vaccine و hyperimmune globulin، يعني نعطيه active and passive immunization. Neonate born to hepatitis B infected mothers should be immunized at birth and given immunoglobulin. Hepatitis B serology should be then checked at 12 months of age. طبعا احنا بنعطيهم vaccination عادة day 0 then day after 1 month, day after 1 month, then day after 6 months, and after we finish the course of injection of the vaccination نسوي لهم HBs antibody titering. فإذا طلع الانتيبودي titer عالي معناته هذا successful immunization. Thank you.